I am Dr. Michael Lynam, family physician at Providence in Lacey, Washington. This video is intended to illustrate how suicide screening, risk assessment, and safety planning can play out in a primary care environment. It can be overwhelming for a provider when a patient discloses suicidal ideation, and this protocol is designed to provide evidence-based, concrete steps that with practice and increased familiarity can effectively manage this difficult situation. The PCP and the patient have a relationship of trust, and when the PCP can engage in risk assessment and safety planning with the patient, it builds on this trust. When implementing the suicide risk assessment and safety planning protocol, one of the key elements that we found helpful was switching the agenda early on in the visit with the patient. This involves early assessment of suicide ideation by other care team members, such as your medical assistants. Once suicidality has been identified, it is important to treat the situation much like treating someone identifying as having chest pain. It will take precedence over other agenda items intended for the appointment. The following role play will demonstrate this. Hi, Manvi.
Hi, Dr. Lynam.
Hey, I'm glad to see you here today.
Thank you for being able to get me in today.
Yes, and my medical assistant told me you were pretty depressed, and actually depressed enough where you're feeling suicidal. Is that right?
It's been hard to get out of bed, and I just really don't want to be here right now.
Right. And I reviewed what else they went over with you, and it doesn't sound like you have any plan or intent to kill yourself. You've just been having these thoughts.
No, I just don't want to do this, but that's like it.
Do you have a counselor currently?
No.
I'd like to set you up with a counselor, so I will give you a referral for that.
Okay. Do you think that would be helpful?
It would be very helpful for you to see someone and talk about that. And when you see the counselor, would it be okay for us to talk with the counselor and communicate back and forth?
Yeah, that would be okay.
Okay. Who else are you living with right now? Who's close to you?
My boyfriend, and I mean, in part of my COVID bubble is my mom and my sister.
Okay. And would it be okay for me to talk to your boyfriend, your mom and sister if I needed to talk to them?
Yeah, it would be okay.
If needed. I want to talk about medications and firearm safety as well.
Mm-hmm.
Let me ask you, first of all, I know you have some medication at home.
Yeah, just that fluoxetine, is that right, that you gave me?
Okay. So it's important that you keep only the amount of medications on hand that you need, and that you don't store up extra medications, and that you dispose of them if you're not taking them.
Yeah, I'm just taking them the way you told me to take them.
Good. And do you have a gun at home?
Those are with my boyfriend in his safe.
So, okay if I talk to your boyfriend about that too, right? To make sure that he keeps them where you cannot access them, okay?
Okay,
during this difficult time. Great, thank you. Most of us will have warning signs when we're feeling down about crises and triggers. Do you identify any things that make you feel bad? For examples of that could be feeling sad, anxious.
And sad.
Those are triggers for you.
Yeah.
Okay. What about feeling stressed or overwhelmed?
Overwhelmed.
Also, feeling trapped or not doing well on things or having arguments. Do any of those?
Trapped and arguments. Yeah.
Arguments too, okay. Feeling worthless or feeling hopeless, are those triggers for you?
Both of those, worthless and hopeless.
Okay, so those are all triggers. I'll make a note of that. All right. And now there are also some healthy actions that most of the time we can do to make us feel better. Do you have any that you like to do when you're feeling down to help you feel better?
I could listen to music.
Okay.
Cooking, I guess, is something that makes me happy. And I could take a walk.
Great. What's the most important thing for you in terms of reason for living?
It would be my family, my boyfriend and my mom, my sister, and definitely my pet.
your pet,
my dog,
and your
yeah.
family, right? Right. Who would you reach out to? First of all, it sounds like probably your mom.
My mom or my sister and maybe my boyfriend too, but my mom.
My mom.
She knows.
Okay. She's who you would reach out to first? Okay.
Yeah.
Do you have your phone with you?
I do.
So I'd like you to pull it out, and I would like you to put in your phone at least one important resource, which is the National Suicide Prevention Lifeline. You can call it whatever you like in your phone, but it's 1-800-273-TALK, 8255. That is.
Okay, I have it.
Good. And while you have your phone out, do you have an app store or a Google Play or some other?
I do.
Okay. Can you search there's this app called the Virtual Hope Box app.
And you said virtual?
Virtual Hope Box app.
Okay, I found it.
Awesome. This is a program that the Veterans Administration actually developed, and it's a way that you can put together things that help you feel better. So nice music, nice pictures, videos, things that remind you of better times. It's really cool. Check it out.
I will. Thank you.
And I want you to always remember that you can always call 911 or go to the emergency room if things got really bad.
Okay, thank you so much, Dr. Lynam.
Yeah. I'm going to give you all this in writing on your after visit summary here today. I'm going to give you this printout with all this information here on your safety plan that we've developed today. I'm going to send in the referral for you to see the counselor. I'm going to talk to your boyfriend about the gun. And we'll set up a follow-up appointment to see me in a couple weeks, okay? Do you have any other questions or anything I can help with?
I was really worried about how this would go today, but thank you so much.
You're so welcome. I'm so glad you came in today.
Thank you, Dr. Lynam.
We'll get through this together.
Okay.
Okay. Take care.